Well, good afternoon, everyone. My name is Amol Nirgudkar. I'm the CEO of Patient Prism. And we're back again in our Zoom studios from our houses, broadcasting to dentistry about everything that we need to know today as we deal with this COVID-19 pandemic. And there's a lot of encouraging news that we're hearing from our clients as well as our friends around the industry about how offices are starting back up. And it's really, really amazing to hear that. I have with me an incredible guest who I heard last week at the DICOMA event. Dr. Mansour from Rodeo Dental Orthodontics is one of our clients and one of our friends over there in Texas. And Dr. Mansour is obviously a practicing dentist and still practices. Obviously, he's the chief dental officer at Rodeo and manages an incredible DSO, an incredible group of dental practices in Texas that are the shining star of the dental industry. So I'm so excited to have you and come on our show today.
I'm happy to be here, Amol. It's a real pleasure. Excited to be here and talk about all the possibilities and all the opportunities that are coming up in dentistry.
It is so encouraging to talk to leaders like you. The reason I wanted you to have to come on this podcast or the webinar, whatever we're going to call it, is really talk about the science behind PPE. Because what we're noticing across the country is there is a lot of fear among team members about coming back to work because they're concerned of all the media coverage or the social media coverage about the aerosols and infection control, all that stuff, right? So there's a lot of fear about that. There's also some fear with the patients, not as much as I thought it would be. There's some fear with them that, hey, is it safe to go to the dentist? And sometimes, as we know, the media loves to just exaggerate all the negatives because that negative news sells 10 times faster and better than positive news. So it's in their best interest to showcase the negative. And I really wanted to kind of have you break down the science and the studies on what is really needed to make a dental practice safe.
Absolutely. Yeah, I'm happy to. So just to give a brief background, before I was a dentist, I actually got a master's in molecular biology and biochemistry. And it was right after SARS. So some of my thesis in one of my programs was about a coronavirus that was SARS. So I mean, it's almost like history is repeating itself just a little bit differently. And now there's the social media and the 24-hour news cycle and all these things. And then I also co-founded and lead an organization with 120 dentists and hundreds of employees. So I understand how to meld both of them. And really this virus, it's something we have to coexist with now. We cannot hope and pray and cower inside, but also just can't go out there in an unsafe manner. It's just like, I was telling somebody the other day, I'm like, well, it's like saying I'm not going to drive because there are car accidents out there. No, you still go out and drive, you put your seatbelt on, you use your blinker, you're safe. You take some sort of precautions. You don't go out there driving 120 miles an hour like I heard you do them all on the freeway, but you're just super careful. So I very much understand what's practical and what's science-based, because we can't be irrational, have an irrational fear. We have to have a healthy respect for it. So, there's a lot of protocols that work. And frankly, they've worked for 40 years. We've been aerosolizing viruses for, decades. This isn't the first time we're aerosolizing a virus. And the PPE worked until this point. The face masks work, the face shields work, the gowns work. Having pre-rinses like hydrogen peroxide. If you use 1% hydrogen peroxide for 1 minute, it works great. It reduces the viral load. If you can't use hydrogen peroxide, you can use povidone iodine as well. And those two work better than Paradex or chlorhexidine. Using a high-speed suction, something like a rubber dam or an Isidry or a dry shield or one of those things, reduces aerosolization by 90%. 90%. So, when you do all these things, when you're screening and then you're doing hand hygiene, proper infection control, barriers, PPE with the gowns, the N95 mask, or actually a level 3 mask is just as equivalent. I found a study that shows that. And then you use eye protection as well. and you do the rinses with the proper high-speed evacuation, I mean, you just keep reducing this risk and shrinking it, shrinking it, shrinking it. And guess what? There hasn't been a single confirmed case of COVID transmission since the thing broke out. And just to put things even into more perspective, COVID was here even before the shutdown, and we were practicing normal. And the PPE we used there was fine. It was working. So it's the mindset that creates this fear, you know. So the protocols work.
You know, there is an unknown saying, an acronym, fear. It says false evidence appearing real.
Yeah.
And I love that, right? Because sometimes we kind of get sucked down by all the stuff that happens on our phones now, right? We're connected to our phones. Facebook groups are all over the place. But if we do all these things, as you said, the masks, the rinses, the evacuation vacuums, I mean, is it safe to say that the air quality in the dental laboratory is going to be cleaner than going to Whole Foods or your favorite grocery store?
Yeah, because that's a really great point. And you know, I was telling people I'm more worried about getting it at the grocery store than I am at the office. You know, people are starting installing HEPA filters and with all these things, and it's worked. You know, the proof is in the pudding, and it's worked before. It's worked for influenza and other respiratory viruses. It's worked for COVID even before. It's working now, and I feel very safe with that. It's just, you know, again, like you said, fear. It's an irrational thing. We're worried about something in the future, so we're not even in the present. We're fantasizing about something that could happen in the future. And yes, it's good to plan ahead and be very prepared, but in a very rational, science, evidence-based way, not based on, you know, what the news says or what somebody forwarded you on WhatsApp or Facebook or anything like that.
You know, so what do you think are the proper measures a clinical team should take? And not just the clinical team that's actually the doctors, the hygienists, the assistants. And then you have the front office, the receptionist, and other people. What do you think are the proper things that are adequate and safe to do?
Yeah, great question, because everyone's safety is the most important thing. Like if we don't feel safe, we can't move on to other higher needs. And, you know, the front desk has to feel safe, and they don't need an N95 mask there. They could use a regular mask. A lot of people are putting the plexiglass between, trying to do contactless things, wiping down common areas, you know, keyboards, things like that. Even certain things like getting paperwork done electronically before, so the patient doesn't have to be in there filling out paperwork, helps the front staff do that. So, you know, that works really well for the front staff. As far as the back staff, you know, I would have them, if they're in a room, if they're chairside, so doctor, assistant, hygienist, you gotta wear a KN95 mask if that's what your state requires. If not, I would wear either that or a level 3 mask, and you can wear just like a regular procedure mask over it and swap that out. Do eye protection, whether it's a face shield or loops and a face shield. If you want to wear a bouffant cap, you can as well, and then a full gown, but just proper hand hygiene, proper barriers, and infection control, and you'll be safe. I mean, it's worked. Like I've said, we've seen it. I personally, I put my money where my mouth is, and I was doing a lot of OS with, you know, high-speed drills and, you know, very invasive procedures, you know, with aerosols, and I did it, and I really couldn't be more confident in these protocols, because I've seen them work and I've read the science on how it works. And I even, you know, I talked to the dean of the dental school, Dr. Bion, in Wuhan, China, actually, and he was holding a webinar on this. And that school was treating known COVID patients during the outbreak, and using these same protocols, had zero people got exposed or infected of this, and they're treating known COVID patients at the epicenter during the pandemic. So if that doesn't tell you the protocols we're taking here are safe, then I think we have to just really take a deeper look at the science and look at the truth.
Well, the issue is, so I guess the clinicians can wear the KN95, the N95 is not available, and the with the gowns and the shields and the rinses, everything else. I
Yeah.
think they should be pretty protected. And
Hmm.
since we're not seeing anything, as you said earlier, you've spoken to counterparts, I believe, overseas as well,
Yes.
and seeing that there's not been a transmission issue at all at
Hmm.
dental offices, provided everybody was doing what they were supposed to do.
Exactly.
Any ideas on any thoughts on COVID testing within dental offices? Is it necessary or
Another
no?
great question. Yeah, it's so there's two flavors basically of testing. In point of care testing, right now there's the antibody testing, which I'm not convinced of the science of it yet in its current form, especially the finger prick. If you do a full blood draw and all that in the hospital, that's a different story. And then there's also the PCR, the polymerase chain reaction test, which is usually a swab, and they measure the viral load, which are quite effective and accurate and can be done. They're very expensive to have the kits and to have the equipment to do. I would like to see at some point uh, state boards recognize that dentists can do that, because let me tell you, as a healthcare professional, dentists can, that we as dentists, we see our patients way more than regular physicians, right? You could go to your dentist probably a lot more than you go to your regular physician, unless you're being treated for some acute condition. But it would be a good place to be able to screen patients, if we will. There's always this fight between the medical board and the dental board and all that. And recently, San Francisco Health Department released a directive saying, hey, you have to have a COVID test. It doesn't have to be in the dental office, but before you do an aerosolizing procedure. And that is just very cumbersome and difficult. And it's hard enough to get a test as it is. So I currently see it as if it was a requirement, being a very bureaucratic roadblock. But if it was something to do to help the public health, can be administered, because dentists are capable healthcare professionals of doing this.
It's a simple thing. I mean, the dentist
Mhm.
are doing a lot more invasive stuff than
Yeah.
just a nose swab. There is, before I ask you this leadership question, I have one clarification that I mean, you may not have the answer to, but there is a discrepancy between what the CDC says and
Hmm.
the ADA says and what the state boards are saying. And,
Yeah.
and so there's no congruency in that. And a lot of times, dental offices are confused about who do we follow, because the state dental board, if they shut you down, obviously you're shut down, right?
Yeah.
So what authority should we be looking at if there is conflicting information on the CDC? Just, I guess, updated their stuff 2 days ago, and but I'm I'd love to hear your thoughts on what's
Yeah.
the right, where do we look for guidance?
Yeah, this was like running track and doing hurdles when the hurdles were on fire, is going, navigating through CDC, ADA, the state dental board, the state dental association, but also counties and cities had their own directives too that we had to follow. So we had to look at all of them. And I saw a big leadership gap, to be quite frank. And I'm going to be a little bit provocative here, but just to challenge everyone and even challenge myself. Looking back, I said, why did we have to shut down into just emergency only? Yet I could take my puppy to go to the pet groomer, and the groomer actually asked me, hey, I can brush her teeth for $12. And I was like, my orthodontists are sitting at home, and meanwhile you're able to brush their teeth. My hygienists are at home, and you guys are going to brush the puppy's teeth for $12. And I just thought, what a leadership vacuum that we have, because there wasn't a single voice. And I blame myself on this too. Believe me, I'm not pointing blame at anybody. But us as a group, if we're going to out of our same mouth, one side say, hey, we're doctors, what we say and what we do affects total health. If we say, hey, periodontal disease leads to heart disease and Alzheimer's and other chronic disease of aging.
Right.
And at the same time, out of the other mouth, and say, hey, we're gonna lay down and sit at home and eat bonbons, so to speak. I'm having trouble reconciling that. And then, nobody communicated with the CDC. Even the San Francisco Health Department, they didn't seek any guidance. They retracted and said, hey, we didn't seek guidance from organized dentistry. And I call it the fallacy of leadership. It's sometimes when we just add rules and add rules and add rules, we think we're doing good and by leading, and it's really to cover your people's own butts, you know, their own organization or their own leadership team's butts. But is it really for the greater good? It becomes so restrictive. It's like this net that's tangled, and you're between a rock and a hard place. You don't know what to do. And I truly believe we have to do our own soul searching. We're doctors, we're leaders.
Right.
By far, we know what the right thing is to do, and what needs to be done. We know the science. And when we have conflicting reports like that, obviously we have to go by what's legal and what the governing authority is, which is the State Dental Board and CDC, not the ADA. But I believe that we have to look within ourselves and do some soul searching and find our own internal moral compass and reconcile that with what needs to be done and what's better for the greater good. You know, I even had the example, you know, somebody with periodontal disease, by controlling their periodontal disease, we can lower, if they have diabetes, we can lower their HbA1c by a whole point, which is the same as what medication does. So when we put that off for, you know, 2-3 months, well, did we help or did we not help? And we have to look at the greater good of things.
You know, and that's part of, I think, what has been lacking in our industry is a PR push. And PR, I don't mean it in a PR sometimes has a bad rep, you know, but PR can be used for good as well. You know, let's promote. I mean, if you are absolutely, if you're believing that the bacteria in your mouth is going to seep into your bloodstream and reduce your immunity and make you more susceptible to infection, potentially COVID, then we need to educate better our patients, our team members, and as an industry, we need to educate the country better, because you know we think about patient acquisition all day long, right? At Patient Prism, that's what we think about, and we think about all the barriers that we ourselves created as dentistry for patients to come in. But why not use this as an opportunity to bring the other 50% of the country who has never seen a dentist and tell them, guys, by the way, we are the forefront of your healthcare. We can be the forefront of your healthcare. We know these are the links that we've already established between oral health and overall health. And this is the time to actually, you know, take your health by its horns and make sure that you have, you know, you've taken care of the diseases in your mouth that could affect your overall health. And it could be such an incredible way. This is, I mean, the crisis could be a great opportunity for us to restart the dialogue with our team members, with our patients, and with our prospective patients who have not seen us.
Absolutely. You know, you really hit the nail on the head on this. Our number one ally in this is our immune system. It really is. When we're stressed or if we're not healthy, we can't fight back. Like some people will get exposed and their immune system will be able to fight it back. And those that are, you know, unfortunately less more vulnerable than us, they can't. And you just simply cannot have a healthy body without a healthy mouth. And this is the opportunity for us to educate and empower patients, for them to be in the know and partners in the care with us, you know, and we really have to do a better job. You said PR, and you know, most people would associate that with negativity, but it's not. It's good.
Right.
We have to. This is education. It's outreach, and we have to let the public know. And I think Patient Prism is a leader in this. And I think we have to let the public know how important dental health is. You know, you know, I'll tell you a personal story. I had a patient come in, and, you know, we did a 3D scan and we found a calcified carotid artery in there. His doctor never found it. And we sent him, we called him. There's another doctor in the building, a cardiologist. He said, send him over right now. We sent him over, they fixed it. He came back, you know, basically kissing our hand, like, thank you so much. Like you saved my life. My dad had a stroke and spent the last 8 years of his life in a bed, and I was going to end up the same. And this is from going to the dentist, you know?
You know, another note, I mean, for the last 5-6 years, and I spend most of my time with dentists anyway. Now, I mean, I spend more time with dentists than my own family and dental team members. And you know, even in the area of sleep apnea, I think our industry has not done enough to educate people that we could be really diagnosing, not diagnosing really because you can't, but we could really help in managing this stuff, which could kill you. And so there is so many opportunities here that dental practices have and the dental profession has to really impact and in grow our pie
Mhm.
of the $130 billion industry, we should be a $500 billion industry
Yeah.
based on what all we can do. And hopefully this crisis does impact us. Well, now, what has Rodeo done
Mhm.
in connecting and kind of communicating all this stuff with its team members and the patients?
Yeah, so we've really taken the lead. We've wanted to get in front of our own people internally early and often and hold Zooms. In fact, matter of fact, we had one yesterday. We formed an infection control specialist team where there's a designated person in each office that's in charge of infection control policies and procedures. And
Right.
we communicate with them and we tell them, hit the science and the policies, and we show them the literature that supports it, and we do it in a way that's not restrictive to running the office and providing care. So we've done that early and often. We do that about once a week. Early in the crisis, maybe about twice a week. Lots of emails, lots of posts. We created like an internal social media platform for us to share articles and share best practices, and we call it Rodeo Mix, which is really cool. I got to give a shout out to the team back there. They're really tech savvy. I couldn't do it, but it's really created engagement on there. On the external front, what we've done is our outreach teams. They used to go to event and always preach this before. Health fairs, things like that. Now that isn't there as well, we've really leveraged social media to get there, so that it's a contactless way of educating the public and letting them know how important these things are. How important dental health is to overall health. So it's really about getting the message out there.
And now that you guys are starting back up, have team members do team members feel a sense of camaraderie more than they did before because you kind of kept in touch with them? That was really important.
Yeah, they really have. So we've kept in touch with them, and we hold these we call them town hall meetings with them. And we had to furlough some people off, and we've even kept in touch with them just to keep them abreast. But as people came back, and obviously we had to bring back smaller teams, what we found is these smaller teams, there was almost like a band of brothers, so to speak, that there was a sense of unity in them, and just the way they've been working together over the past 2 to 3 weeks has been phenomenal. Like, I couldn't be more proud of what they've done. You're talking about a fraction of the workforce that was there doing almost double the work, and happy to do it at the same time, because in the face of crisis, I think leaders emerge, and we've really seen who the leaders are as we've gone through this. So it's really the cream rise to the top is what I can really say about them.
And what have you said to team members who still feel scared?
Yeah.
Come back. What's your approach been with the hygienist community has been quite. All the groups are filled with attitude on both sides. How have you handled that issue?
We handle it with empathy and compassion. We tell them, if you're scared, like, it's okay, stay home. Like, no worries. We love you. We want you to feel safe. Like, there's no need for you to come in and we would never want somebody to come into the office and feel unsafe or to spread that panic to patients or to other people. If you look at Maslow's hierarchy of needs, safety is number one. Otherwise you can't even go on to other things. So it's like, hey, it's okay. Like, wait it out. We'll come back. They'll find another checkpoint and we'll come back to it. And we've had a couple like that, but that's been more of the exception than the rule. Most people have stepped up. And I think my first day in there, I huddled everyone up and I said, hey guys, let's talk about it. Let's hug. I call it hug the monster. Let's hug the monster in the room. And how do you feel? And I kind of put things in perspective, like, now. And like, okay, like, that makes sense. And I said, guys, like, if you have any questions, like, we're all here. I'm here to keep you safe. Like, if that's my job, is to keep you guys safe. If we weren't doing something right, I wouldn't be able to sleep at night. And I have a strong moral obligation to make sure that we're doing the right thing. And, that's one of our core values at Rodeo is, we call it #do the right thing. And I think we've done a tremendous job of that as a team.
We've rallied around that people before profits. If you see it everywhere else, and we've always said that if you take care of your people, think take care of themselves. How's the mascot doing during this pandemic?
The is on sabbatical right now.
I was in a video with him. Uh,
Mumu?
the bull, yeah.
Yeah,
We're gonna put this picture of me with your mascot
that's awesome.
in Dallas because we flew into Dicama
Yeah,
video and we did the mascot, and I was in several shots with the mascot.
I'll tell Mumu you said hi.
That's right. Mumu was a very good mascot actually.
Yeah,
I spent some quality time with them. But you guys have done such an incredible job
we appreciate it.
at creating this brand that is cool, that's exciting, that cares about the community, and you built an organization which I was floored by when I spent time at the headquarters with
Mhm.
Dr. Zarabi and your team. I was amazed and floored by how much you've focused on visibility and you're like a situation. You have a situation room
Yeah,
where you get to see what's happening, all the offices and the KPIs. Everybody talks about them, but you guys actually do it. And
yeah.
so you guys definitely are the North Star when it comes to
Thank you.
adopting of things way before the industry ever does. And I hope a lot of the industry pays attention to what you guys have done in this field to promote dentistry to
Mhm.
more patients and to really look at that journey of the patient. I love that chart you guys have with the journey of the patient,
Yeah, the
and it's
patient experience map.
the patient experience map. It's so
Yeah,
beautiful, and I'm so happy to have met you guys last year and learned more about your philosophy. But I think this is a great webinar.
we appreciate it.
I think we are going to have a lot of people watch this because there's a lot of fear. I think we need to get rid of that fear, and I think
Absolutely.
industry is so essential, and we need to promote this till we're blue in our faces that dentistry is essential.
Absolutely.
Um, and as I hope our organizations, whether it's ADA or the ADSO, take a lead in really taking this crisis and turning it upside down and saying, let's make people get dentistry that they all deserve,
Hmm.
and let's bring more people into the system so that we can really improve the health of our country, our nation, our world, our society. So those are my only parting thoughts. But
Well, I mean, thank you, Amol. It's for the very kind words. We loved having you. Happy to have you back anytime. Next time you meet Mumu, he'll be wearing full PPE
that's
to be
that's right.
safe.
That's right.
But you really hit on something that struck me. And through crisis breeds clarity, and the clarity I've had is we really need to lead. And if there, God forbid, is another shutdown or another outbreak later, us as healthcare providers shouldn't roll over and play possum, or should at least have the choice to say, hey, we are an essential part of the healthcare system. Where can we step up and help? How can we help? Rather than a blanket like, oh, we can't do these procedures and you can't do that. Well, at
Correct.
what point, at what cost to people's health? How many people were hurt by certain things that they couldn't come into the dentist because of something? So I'm really going to challenge all the dentists out there and hold me accountable as well. I guess I'm saying that on record to help lead in that. I can't do it alone. I can't do it without my fellow professionals, doctors and non-doctors in the dental field. We're all in this together. And the more we help each other rather than pull apart, the better it lifts the profession, and the better the public sees it and sees the value in having a healthy mouth and going to the dentist. So that's my challenge to everyone out there. I know it's a little bit provocative, but I think without a little bit of tension and friction, that's where we grow. And this is a good opportunity to rise out of a crisis.
This has been such a fantastic, and it went way better than what I expected. Thank you, Mansour, so
I'm
much.
happy to help anytime.
We will continue this discussion in person, hopefully in Dallas soon. And
I hope so.
again.
Thank you, Amol. I appreciate you. Thank you for everything you do.
Thank you.
See you later.
See ya.
Thanks.